Thank you, Madam Speaker. I rise this morning to ask question 64 of 2015 under my name to the Minister for Health and Medical Services. Customer service continues to be an issue for the Ministry of Health and Medical Services. With the staff of the ministry being identified as complacent, have integrity issues, are not responsive to the patient's needs when required, and considered unfaithful towards their work. They have been criticized for providing poor and quality services. Could the Minister inform what is the Ministry's view on these issues and how are these issues being addressed? Thank you, Madam Speaker.
Thank you. I give the floor to the Honourable Minister for Health and Medical Services.
Thank you, Madam Speaker. I'd like to thank the Honourable Member for his question. I think a question that is something that is important to everybody in this country. Customer service and customer focus is an issue for all organizations, and it's something that I believe very strongly that we need to address. In the Ministry of Health and Medical Services, we have examples of both. We have examples of very good customer focus and examples of very poor customer focus, customer service. Of course, it is the examples of poor customer service that come out in the press. A lot of times. I must inform this House, I get a lot of messages from people that email me talking about examples of good service. Those ones never come out in the press. That notwithstanding, if we're talking about customer service and customer focus, we need to be looking at the things that impact on customer service and customer focus. Obviously, there are a lot of things that impact how people react in the work situation, how they're brought up, whether they had a good day, they had a good breakfast, the way that people talk to them, all kinds of things. And it can also be a function of the volume of work that people are expected to work. I've mentioned in this House before that we have doctors who will deal with up to 120 patients a day. Some of them work 24 hours. And if you have that sort of a situation, obviously it's going to have an impact on the way that they interact with others. I believe very strongly, and this is something that I've stressed since I've taken up the role at the ministry, is that customer service, customer focus is something that's important for everybody who works in government. It's important for all of us in Parliament. We serve the people of this country. We need to be focused on all of the people. And that is the message also that is being passed along to the people in the Ministry of Health. We have the message that has been passed on to them that we need to focus on the values that we have in the ministry. The number one value is customer focus. Other values that we have like integrity, quality, and so forth. I've tried to identify some of the reasons why we've had this problem. One, there has been a culture that has been there that will need to be fixed. One of the issues that we've had, I've noticed that in the past, in the initial training of people that become professionals in the medical field, in the health field, customer service is not part of the initial training. It is something they pick up along the way. So that is something that we need to rectify. We need to put in capacity building programs to try to create a customer-focused culture. Changing the culture of an organization or a ministry or a sector is a big task. It's a huge task. So with this in mind, there are a number of things that I'm hoping to focus on in order to try to initiate that customer culture change. The first is a mechanism that we already have in government. It's called the Service Excellence Awards process. I believe that this mechanism, if it is ultimately becomes, if the principles are absorbed by everybody in the ministry, it becomes their principles. The values become their values. If the values become the values of the leaders of everybody in the ministry, then it will begin to have an impact on everybody in the organization. Another thing that affects customer focus or service is the processes that we have in an organization. Anybody who works in an organization is restricted by what they can do, by what the processes allow them to. So if you want to improve the way that they interact with customers, you've got to address the processes. And this is one of the things that we're focusing on this ministry. The second thing that we hope to change the way that people focus on their customers is to bring the values into the way we manage performance. In the performance management systems that we've had thus far in the ministry, it is focused on the clinical things, the number of patients that you see, and so forth. What we need to do is to take the values that we have in the ministry and bring it into the targets that people have. So we have an exercise going on right now where the annual performance assessment report system are being modified so that we're taking the values, for instance, the value of customer focus, and we're asking ourselves, this value of customer focus, looking at the different job categories that we have in the health sector, what are the specific behaviors that you need to be able to see that shows that a person has this value of customer focus? Because value is something that you can't see. The only thing that you can see is behaviors. And we're taking those values and building it into the requirements of each person. And that will then be assessed and monitored over time. And as a result of this, if we identify gaps, of course, we then can address it through training, through counseling, through transferring. When if we also identify issues where people are excelling, then we need to show appreciation, need to give rewards. The fourth thing that I believe that I am hoping to be able to, that we'll be able to develop to enhance customer focus in the Ministry of Health Services is to develop strong leaders. Strong leaders who demonstrate these values. I believe that the most important thing in an organization is leadership. You get good leaders in, they will change the organization. And that is my hope going forward. Changing the work culture of any organization or a ministry such as the Ministry of Health is going to be a huge challenge, but I also take my hat off, even though I'm not wearing one now, to those who have been able to demonstrate excellent customer focus despite the difficulties that they face. Thank you, Madam Speaker.
Thank you, Honourable Minister. Supplementary question, Honourable Boltabu.
I thank the Honourable Minister for his responses this morning from a human resource perspective in regards to the capacity building in our health services. Is the Honourable Minister aware that the few contributors in the poor service delivery in our hospitals are due to the 32-hour shift by our doctors, 24 hours plus another 8 hours for their ward rounds? Secondly, the technical part of medical services, biomedical, the machines, breakdowns of machines. In Lambasa Hospital, during the dengue outbreak, the blood tester was down. They had to take all the samples to Senganga and Nambono. In addition to that, Madam Speaker, the lack of medicines. Lambasa Hospital has been, there's a shortage of medicine, and medicines have been loaned from health centers. Is the Minister aware of that, and what actions will the Minister take to address those issues?
Thank you, Honourable Minister.
Thank you, Madam Speaker. I thank the Honourable Member for his questions on the issues of medicines and the need for the biomedical equipment working. Yes, those problems are there. We're very well aware of the problems, and it is something that is constantly being discussed within the ministry with the senior staff, and we're constantly developing processes to try to address the problems. So the short answer, Madam Speaker, yes, I'm aware of the problem, and we're discussing it with the senior staff to see the best ways that we can alleviate these problems.
Thank you. I call on the Honourable Salvatore Ndongo.
Thank you, Madam Speaker, and I thank the Honourable Minister for Health for his explanation on customer service, and which I fully agree with. But my question is how that customer service is going to be taken down to the staff, particularly in terms of system and process improvement. And if I may just enlighten on that, for example, I came across a case of a woman that was wanting to rebook her appointment in a special clinic in CWM, and she was told to go back to her own health center, which is in maybe Valelevu. And in Valelevu, she was again told to come back to CWM for a report, to get her report so that the Valelevu medical officers can then attend to her. So my question is based on that process and system improvement to take away the burden on the patients in terms of financial and also emotional, which might, at the end of the day, the patient might just give up and not go for treatment. Thank you, Madam Speaker.
Honourable Minister.
Thank you, Madam. I thank the Honourable Member for the question. Yes, I do agree. As I mentioned before, one of the issues that affects our ability to focus on customers is our processes and our systems. That is why I've emphasized in the ministry the need to look very clearly at the Service Excellence Awards process, because it focuses on this area. This is an area that we have not given enough attention on, and it is something that I've asked the ministry officials to identify what are the most critical processes that we have, so that we can work to address the requirements of our customers, our patients that come to us. And over the next few years, we hope to be able to build an internal capacity to measure processes, to manage them, to remove the non-value adding components of processes, enhance them so we can deliver greater customer value, greater patient value. Thank you, Madam Speaker.
Thank you. Honorable Randondro.
Supplementary question, Madam Speaker. Last year, on the last pay of 2014, most of the staff at the ministry had their contract expired. But they were told or informed to continue to come to work until February, when the contract was renewed. What I'd like to ask the Minister is he aware? And what actions have you taken so that this issue is not repeated?
Thank you. Honorable Minister.
Thank you, Madam Speaker. Thank the Honourable Member for the question. I think the question is relating to the same thing. It's relating to the need for processes to be reviewed, and I must inform the Honourable Member I am aware. And I've raised my concern with the Acting Permanent Secretary and his staff, and the need for them to review all of those processes, to identify what is causing the problems and to remove non-value adding components of this and make sure that we can fix that particular process. Thank you.